I care for my daughter who is got a rare brain disorder, and it was quite ill all the time. It was always quite difficult to get a service that would meet her needs, and it was always an uphill battle, and you were always fighting with people and trying to get people to listen to you and realise that one size didn't fit all, and that people were not textbooks.
The negative sides, it seems to be the lack of communication at times, and this has happened to us on a number of occasions where we are sitting perhaps waiting to be given information or to find out what's going on.
Communication is always an issue. I've always had problems with the communication in the region, where somebody can go into one hospital for treatment or go to one agency for treatment, and you have to start off taking a history.
You felt the decisions were being made and you were having no say in these decisions, and that again felt very difficult for me, and I felt like things were happening beyond us and we were on the outside looking in.
Even though I had a disabled child, I did go to school myself and was educated and all of that. So people, I sometimes think they forget about that side of it. They see you coming and they think that you're maybe a wee bit stupid, or you have no understanding, or how would you understand this because you haven't went through the same systems as we have. You didn't go and do your nursing, or you didn't do your university degree in social work or whatever. But unfortunately that's not the way it is, because when you live with somebody with something wrong with them, you learn very quickly.
The problems really may emanate from a situation where education is providing somebody to work in the workplace, and then the actual establishment, the management within the different trusts are not recognising that and the value of those people and matching the client with the skills of those staff who are trained by the university.
The public pays substantial sums of money for the health service, pays substantial sums of money for directly or indirectly for nursing midwifery education, and they expect their needs and their personhood to be valued. We've worked hard, as would other schools of nursing, to try to develop a educative process that will deliver quality of care. However, that's has been working in something of an isolated vacuum. Although many of us would be directly or indirectly users of the service, primarily we remain as professional educators and professional clinicians. User and carer involvement will hopefully more effectively focus our work here, our educative process, our learning process for the students on quality of care.
I have recognised the fact that there's a wide variety and diverse group of people that exists within Northern Ireland that need to have their voices heard, and I think the university are taking a major step forward in doing that, so that they will be able to pick up on some of the more intrinsic problems that exist within delivering care and delivering staff to be able to provide care for this client group.
The more people who are involved in health and social care provision we have at the earliest onset of student nurses training and preparation, then the more beneficial nursing practice is going to be. So from that point of view, it's very, very important we have users and carers having a say in the formulation of curriculum, in the development of curriculum, and indeed the approval of curriculum. And then from that point, if we have their involvement in the actual implementation of the curriculum, then we can actually see we're capturing their views and thoughts and so forth, and then obviously in the review process of that curriculum. It started very carefully in terms of ensuring we had the right people on our group and so forth, and who can certainly articulate the voice of the service users and carers in a meaningful and a meaningful way. And being perfectly honest with you, we've actually let service users and carers set the agenda, and we've said this is the way we're going. We're committed to the process, and let's work together on finding how best you can contribute.
I think we're a very dynamic group. We're becoming together now, and we come from very varied backgrounds, but we've all got the same issues there too that we want to take forward. And it's the teaching and how it's done, simple ways, sometimes sophistication can mask an ongoing problem, whereas if it's sometimes I can say something simply as, that did not work.
We can communicate on a very regular basis what's happening in our world, what's happening in the health and social care world outside, and we have a much broader overview. It's not just nursing.
Today I could be a doctor, or I could be a nurse, or I could be a social worker, or I could be a care manager, I could be any of these numbers of people that I am, because I have to do this for my daughter.
I think the educational programme is going to be so much more diverse and dynamic, because you have people on the ground coming in and saying, well, listen, you know, I was in hospital, that didn't work. I was in hospital, this was fantastic. You know, I had these girls in and they did this and it worked really well and they were very happy to do such and such, and it's just an easier way of programme and facilitation for service user carer and for the nursing staff as well.
Students will get used to the idea from a very early point in their nursing career that the voice and the views and the thoughts of service users and carers is paramount. Not paramount, but is as important as anybody else and so forth. And that's the message which we want to sort of engender within all of our students. And from that premise, we would argue, and certainly the literature argues, that once it's ingrained in their thinking in the pre-registration level, then when they go on to qualify and graduate and they start to work with students in the longer term and so forth, capturing the views and thoughts of users and carers will just be a normal part of the day-to-day practice. And of course, if we get to the point where the voice of students, the voice of users and carers, and the voice of practitioners are all working together in transit, then we're in a much better place than we are maybe currently or certainly heretofore.
The first challenge, if you like, will be to encourage and facilitate colleagues to a closer, progressively integrated partnership in working with users and carers.
People are always afraid of change, and unless you come from a background where you have been educated or you've went to university or whatever, sometimes people are a wee bit standoffish and thinking, not sure here, would they understand? But I think we have a really good understanding of it and can change and embrace change, because I think for to do change you have to involve everybody.
Where we can come in and say something that perhaps some of the tutors can't, perhaps they can use us in a way where it's a friendly, this is what's happened to me and I don't want this to happen to you. So these are areas that you can be aware of, and if we give practicalities of issues that have happened to us, then I think it's more likely that a nurse maybe will take that on board rather than a practice bit, you know what I mean, on an area there where it's you're reading it off script when it's not the same.
I think life stories and real life issues that are there, may it be good or bad, I think there's always learning in it, but people are afraid of that. People are very afraid of, well no, look, we can't have people telling bad stories. But if we don't tell them, we won't learn.
I've spoken to quite a few of the young student nurses, either first, second or third year nurses. And I've also spoken to community nurses too, who have been coming from Queen's out into the community doing a placement there with community work. And I find that they are really delighted in such a way where they have seen me give a lecture. And if I remember, oh yes, and you said such and such, and ever since you said that, I've been very aware with that because I'd taken a wee note. And I mean, to me, that was wonderful to get that positive feedback that somebody remembered me, that maybe helped them to put something else in place.
I would expect it to impact predominantly in terms of quality and quality of care delivery, quality of communication, and better reflecting real patient and person needs.
I think it's important as well that we join it all up, that it's not just nursing, social work, that everywhere within the university there should be carers, service users involved in developing and making it better, because there's no point in doing this if we're not going to make it better. And I believe the work to date that we have done within Queen's, and we're only up about 6-7 months, we have made some differences already.
Nursing is now not just a hospital profession. Nurses are now in very many different settings, and they're in special schools, they're in nursing homes, they're in day centres. Their remit is much, much broader now, and I think it's not just, you're not just in a hospital, so you have to constantly change you have to constantly adapt to the changing demands of the healthcare world.
When students go on to qualify and graduate from university and become independent practitioners themselves, they'll be very mindful that the people they're working with, the voice of the people they're working with on a day-to-day level, have a view, and that view must be captured and thought about and considered when delivering nursing care.
Nurses are in such a privileged position, and they are the people that I go to first and foremost all of the time, and that for me is a key message for young nurses.
I've looked through the curriculum which was given to us when we started off having these meetings. I had some concerns, but they were alleviated by what I've seen in the content of the training programme.
I have to say I'm enjoying this challenge at the minute within Queen's. It's very, very good. I see some gaps, but I see a lot of good work as well. There will be difficult times, extremely difficult times, where people will not agree, and but that's the nature of it all. We have to agree to disagree. But no, working together, involving service users and carers from day one is a very, very good way to work.